Hi everybody, my name is Natalie Gibson. I'm a board certified PA or physician assistant at Sanova Dermatology. I practice at our Central Austin location and Dripping Springs. So today I am going to be chatting about Sculptra Aesthetic. Sculptra is an injectable, but it's a little different than other fillers on the market. And I'll kind of go into why. This is going to be a Q&A with the most commonly asked questions about Sculptra. All right, so first I want to chat a little bit about the aging process because that is fundamentally where Sculptra performs. So as we age, we start to lose collagen. Starting in about our mid-20s, we lose about 1% of collagen each year. And then by the age of 45, we've lost about 25% of our collagen. There are two types of collagen that we see most commonly in the dermis, type 1 and type 3. Type 1 is the most abundant, and that is what Sculptra is sort of targeting to help rebuild. So what is Sculptra? Sculptra is made out of something called poly-L-lactic acid. That's been around in dissolvable sutures since the 70s. So our body can go and basically metabolize those sutures and get rid of them. And so they made a polymer of that in Sculptra in a powder form, which we know will then allow our body to stimulate a process that will rebuild collagen fibers. The way it works, it's not like a traditional injectable HA filler, which you'll see in a syringe. This is actually a vial of that poly-L-lactic acid in sort of a powder form. We, in the office, will inject sterile water to create a reconstitution or a nice liquid substance. We can also add a little bit of lidocaine, which will help anesthetize as we inject for your comfort. And then that is drawn up into syringes. So we inject this formulation into the areas that we are looking to rebuild, which typically on the face include temples, lateral face, and then the nasolabial fold and marionettes. You can start injecting Sculptra at any age, so it's very dependent on what your goals are and how you've aged, but it's safe as early as your 20s and then all the way up until your 70s. The quantity of Sculptra will vary depending on your age though. So I've mentioned a lot about collagen so far and kind of how this is a collagen stimulating product. So what's the difference between Sculptra and collagen supplementation or collagen powders or collagen stimulating creams? So Sculptra is injected into the subdermal layer, which is right underneath the skin. And that's where you're getting that activity, that rebuilding of collagen tissue. Whereas a collagen stimulating cream isn't going to be penetrating as deep. So you might get some nice anti-aging benefits from a cream, and it's always great to have a great skincare regimen, but it's not going to have the same effects as Sculptra. Collagen supplementation is very trendy and popular right now. Vital proteins, different powders you can add to your coffee. Some people love it, and there's some anecdotal evidence, but we don't have a lot of data to support it. And something we know happens anytime we ingest. We have lots of digestive enzymes that break up proteins. So it is thought that it's unlikely that there's a lot of those collagen proteins that are actually making it to the dermis, which is where we want that collagen restimulation. What areas does Sculptra treat? So I kind of mentioned this earlier, but it's FDA approved for the deep wrinkles and nasolabial folds. So this is the most common area, but it's also really nice in the subdermal layer out here underneath the skin because we start to see some hollowing underneath the cheek. Temples is a great area. It's a sign of early aging. Those are the most common for the face. Now off the face, the necklines, the tech neck can be a really nice place for it. The decolletage, so even wearing a blouse like this, women, we get a lot of sun exposure, and a lot of UV damage to the décolleté will cause an increase in the aging process with more skin laxity. So this is a really nice area for Sculptra as well, if you find that you feel like the skin is just getting thinner. The buttocks is a big one on social media. It does require a lot more Sculptra. So I mentioned that they come in vials, so it requires multiple vials in order to get the results that most people are looking for that butt augmentation. How many treatments are necessary? So this is a really important question, and this is also very different from other injectable fillers. Sculptra needs to sort of build on itself, so we typically recommend 2 to 4 sessions spaced 4 to 6 weeks apart. And the number of vials recommended at each session will just depend on your goals and your assessment by your injector. Next question, when will I see results? So typically results will be evident after 3 months, because that's about how long we see that activity happening where our body is re-stimulating the collagen. When you leave, you will likely feel like things look really good, but like I mentioned, the way we reconstitute Sculptra, there's a lot of water. So a lot of that volume that you're seeing is water, which will go away in a couple of days and you'll go back to baseline, but that poly-L-lactic acid is still there, and that will start to work the way it is supposed to, and your body will sort of break it down and then stimulate and lay new collagen down after about 3 months. Is it safe, and what are potential side effects? So yes, it is safe. It's an FDA-approved injectable filler. We know that the FDA, there's a rigorous process when it comes to clinical trials, but like anything, there's always risk involved. So typical risk factors or adverse events that we see include bruising, injection site reactions, swelling, or nodules, and there's ways to prevent almost all of those. So bruising is probably the most common. Anytime you put a needle to the face, you're at risk of bruising. It's really important your provider goes over your past medical history, your medication list, your supplements, because certain supplements or medications can contribute to excessive bruising. So that's something that you would discuss with them. In addition to past medical history, if you have autoimmune conditions or anything that we need to know about, you might not be as great of a candidate. Most people are candidates, but that is a discussion to have with your injector. Swelling post-injection is very common, but we do recommend icing. That always helps with swelling. And then lumps and bumps. So this is a big one. Post-injection, it's really important to massage the areas that were treated, and the reason why is we want to get the best integration and reduce any risk of nodules. And so it's recommended to do the 3-3-3 or 5-5-5 rule, and that's massaging the area gently that was injected 3 times a day for 3 minutes for 3 days, or some people recommend 5 times a day for 5 minutes for 5 days. And that ensures that you don't get those nodules. Sculptra is not made out of any human or animal products, so there's no allergy testing required. Can I use Sculptra if I had filler or Botox / Dysport / Jeuveau / Daxi now? Yes, it is safe to do all 3 if you are looking for an overall pretty immediate improvement, but that is dependent on your goals. and the assessment with your provider. So there's no contraindication to doing them alongside each other. They actually can complement each other quite well because they have different purposes. How long do the effects of Sculptra last? So Sculptra lasts up to 2 years. And after your series of treatments, we mentioned about 2 to 4 typically, maintenance treatments might be recommended, which those would typically be 1 or 2 times a year. But because of the way it's addressing the root cause of aging with that collagen stimulation, the results sort of build on itself. So less frequent maintenance injections would likely be indicated. So I think I've answered all of these questions. If you have any additional questions, please feel free to come see me in the office or any of our Sanova providers. We're happy to answer these questions for you and see if you're a good candidate for Sculptra. Once again, my name is Natalie Gibson, and I hope you have a great rest of your week.